My name is Matt McCarty. I've been a physician for 30 years. What interested me getting into medicine was my desire to be needed. After moving to Austin, which is a vibrant city filled with active people, I said, it's time to start Balcones Pain Consultants, and we started the practice, really focusing on getting people less dependent upon medical interventions and medications, but getting them back into living.
My name is Dr. Gus Lowry. I'm a chronic pain management doctor, and I chose medicine as a career primarily because it allows the ability to use knowledge to help people, and that was an easy decision for me.
My name's Ray Jimenez, and I'm a physician here in Austin, Texas. I have been doing medicine since 1986. I've always been one who believed that the practice of medicine should be really a holistic practice, but in the real sense of the word. I'm in favor of doing anything and everything that helps.
As physicians, we all took an oath to sometimes cure, never harm, but always comfort. And at Balcones Pain Consultants, when you first come in as a patient, you're going to sense that, be it the kind voice of our receptionist or the touch of our medical assistants, our nurse practitioners, our physician's assistants.
I'm Leanna Ochiltree Burnell. I am a patient of Dr. Matthew McCarty. I've been a part of his care for the past 12 years plus. And when I came to him, I was referred, but I was just almost at a point where I felt like I was going to give up. The Lord sent him to help me function, which I've been functioning. The things that I'm able to do now with God allowing it, with the medications and the things that I've went through with Dr. McCarty, as being a friend, being a mentor, being someone that personally cares for my life.
We want to create a welcoming environment. We want to create an environment that feels caring from the moment you walk in our doors. We want you to know that we hear your complaints. We know you're in pain, and we know you've been dealing with it probably for years. We utilize a wide array of treatments, including injections, medications, counseling, wellness focus, and physical therapies. All of these combination treatments help to get a better result, which is reducing your suffering and helping you live with chronic pain in a way that is more comfortable.
My hope for a patient when they come to Balcones Pain is to get them to a point of relief where they can then start to gain control of their life. Pain robs people of their life. It can rob them of their time, of their sleep, of relationships. And if we can get the treatment and get them back to a point where they are feeling better, to where they even are considering going out and becoming active again, exercising or walking with their significant other, their spouse, or volunteering, then I feel like we have done something really important here.
I've been with Dr. McCarty for 3 years, and when I started having pain, I went to him, and that helped me to relieve the pain so I can continue doing and serving the community the way I like to do. Since I retired, I've been doing this, and I don't think I could just sit around the house doing nothing when I can still serve the community in some way.
My wife and I are both retired, and our goal is always to travel. And we've been traveling 3-4 times a year. That wasn't possible when I was having the serious pain in my back. The vacations were short, sweet. That's when they referred me to the spinal stimulation, which is where they implant a wire up your back. And I was able to then, when I felt pain, turn it on. And what it does is it tricks your brain into that your back doesn't hurt anymore. And it worked. With this device implanted, the last 2 or 3 vacations have just been fantastic. No pain hardly at all.
We are going to take the time to come up with a treatment plan that is suited to your condition, and with the goal in mind that we know that there's no single best treatment for your pain, but we're going to find the best one for you. We're going to find ways to reduce side effects with medications. We're going to find ways to get you your life back.
You need somebody who deals with the problem that you have in the way that it needs to be dealt with. And in having a group of people with different interests in their specialties, I think you can get to the person that you really need to be with. And I think it offers you a whole lot more variety in the kind of care that you're going to get. That's what's really important, is to get the right kind of care from the right people.
We want to give our patients the right medication tailored for the right person. And that often involves genetic testing. And we find that having our own pharmacy with a focus on that specifically will help us to achieve that. Chronic pain has no place in Austin. If what we can do is get patients back into their sport, back into volunteerism, back into relationships, we've done a lot of good here in Austin, Texas.
When we hear that we're able to provide pain relief, and a patient tells me a story that I was able to go to my daughter's graduation, or I was able to go to my nephew's wedding with less pain, then we know we've made an impact. We know we've had a victory there, and that's a success.
Ultimately, the goal in pain management is function, is to get people back to doing what they need to do.
We want to break the grip of chronic pain in your life and get you back to living the life you're created to live.